In the wake of the novel coronavirus, a behavior change organization based in the Upper West region, Ghana, stepped in with an innovative way to mitigate the spread of COVID-19. In April 2020, Amplio Ghana, formerly called Literacy Bridge Ghana, partnered with Ghana Health Service to launch a COVID-19 awareness campaign in 8 vulnerable districts. Community health nurses and volunteers used the Amplio Talking Book audio device to deliver consistent and accurate health messages about COVID-19 symptoms, treatment, and safety.
Following the outbreak of COVID-19 in Ghana in March this year, as an organization specialized in delivering awareness-raising programs, we thought we could contribute to one of government's strategic goals, which was basically to make people in Ghana aware about how to protect themselves from contracting COVID-19. In a pandemic like that, stakeholders in one way or other chose to support government efforts in different ways. We chose to raise awareness, especially targeting the most vulnerable people in rural areas of Ghana, especially in the Upper West region of Ghana, where we had this response.
So we as a team decided, as an organization, in our past experiences, we've used this technology to reach a lot of people in different ways, in different islands. So we came together and realized that, okay, why don't we use the existing structures that Ghana Health Service is using? We also realized that about 60% of these nurses couldn't even speak the local language. So how do they do health promotion? How do they talk to these people who do not understand the true language or maybe the English? We selected these 8 districts because they were those that were sharing borders with Burkina Faso. And as at the time when COVID came, the caseload in Burkina Faso was also kind of going high.
The talking book became part of our strategy, especially in the fight of COVID, when we needed to reach out to many more people with messages on COVID. You know, COVID came as a pandemic, and Ghana was really not very prepared for it. And so there was a need for us to make sure that people in deprived areas, people in the communities who knew little about COVID and had no access to television sets, had no access to even radio, would also hear the message. Because if we wanted to actually control or to curb the pandemic, we needed to reach out to many more people. So that was when we realized that the talking book was needed critically to make sure that messages on COVID, especially issues about the signs and symptoms, what to see in an individual and to know that, or to suspect COVID, and also talking about stigmatization, talking about where to seek help, and all the other things that we needed to talk to people about on COVID.
Initially, we had a problem of utilizing our few health workers to go around our communities to render health education. We have just some few health promotion officers, but the talking book has come to enhance the work of the health promotion officers and our community health nurses, our CHOs at the community level.
COVID came into the country in March 2020, and everybody was confused. We didn't know how to curb the occurrence. So we were looking for support from places in terms of sensitization, education, and the treatment if you have people who show clinical signs and symptoms of COVID. So teams were formed, and one of them was a Public Health Emergency Management Committee that was instituted. So in our plans, we noticed that it is very important to have community sensitization. And having community sensitization, you want the messages on COVID to get down to the people. So we wanted to do dawn to dusk education. We wanted to do education at marketplaces. we wanted to even use other social places, gatherings, to do our sensitizations. And fortunately for us around that time, Literacy Bridge Ghana surfaced with an audio device which we can use to disseminate the information. This talking book, it has been helpful to us in terms of health education to our community members and mothers, because before the talking book, staffs, especially those who do not understand the local language, find it difficult to reach out to mothers and caregivers. But with the help of the talking book, they are able to reach out to them.
It has helped us in reaching a lot of people. Since COVID-19 came, it was actually a headache and stressful for us to go into the communities to organize their best and speak to a large number of people. But since this talking book came into existence, it has helped us anywhere we go and we gather people. We just play it for them to hear what COVID-19 is all about.
The talking book is helping us very, very well in our workplaces, especially during past are the days we used to give health talk ourselves and so ask questions ourselves whether the people had the information or not. But with the talking book, it has reduced almost all the work. What we usually do is, after they listen to the talk from the talking book, we just ask what they heard. That's what we do now. But the talking book does everything for us.
Abukuya wosoma na papa wa iyi dina ala eme don't yare ma enyune ba miti ke jirile eche bu abunya ende tere ma ti yara bara ndo mi yiji aba che kan ba ba yarele so ba wa che kale ba yare e mala su yilia bala pamle te kwasin pan soroma ka pan yikroba so vena ka entum ko ilafie no vena ka ndo me janye na ba yi na abuku po sin anto e ka asuna ndo le ba bira ba le ba bira ba ngwe fu chin de abi chin pa da u chin yo o ma on je bo pora ka to ko ta u chin yo bo ga wo te ta da ko te yu pi na unu no pe ba fu chin de ya ifu nyana ba lulu a roba se galam bibil a na ba on yo ba na ba pi ba lu tan ya
wele yele yo ayi wala se bilinga po ka corona virus na wa te piore tindu ane samna ane kuwa ne chuwe suru yele mengala amana biri ana yi deme te ka te piore la tindu na te samna na kuwa ne chuwe suru alawa tile yele ne ko me ai ndo pora ne karmanta ndo pora a pora te no te ka te tera sa munga za a pora te ne alawa ayele ko ne nga tun wate kwara hude ho pampon bel ine ngambe hude tanbe apwa hondwa ate kwa wachire se ka ho bozine ina akira ho mente tabon kira mente bale ka ayal aponi habie so asa yele nga ko ani ye wala si bilpo asu nan le ba yo hakbo so bam wana yo hakbo ne ka barka ataba asa yele nga banan wanana
It was a very important means by which we were able to communicate to our people. Soon as we recorded the voices, and anytime we had meeting and discussion, we had it played back to our people. The people began to understand the whole issue of the coronavirus, and I think that may have contributed a lot to the minimal or no cases of virus recorded within my parliamentary.
Wana kuruna ya yao kumene yeni mwa memba do be hawe kama wa bol ne ba ja ko wala man da kuruna bonga agan bitu yu ai mo ba tu bitano on ya ban ja woni man yara kuru ya manga ya palo ada so yan ne ba yan ne ba ya okta ba ta gana o pa ta gana me atun dian ko ona nyoto.
The talking book meets a certain requirement that other media or other channels do not meet. By that I mean its portability and also the fact that it is used per our advice at the time of the day that most people are home, and the same message is available. It's not like a normal radio system where particular messages are discussed at a specific time where one may miss out. This particular device is able to give to play the same message consistently, and I believe this consistency is an advantage to the talking book over others.
The project recorded some challenges at the early stages of the program, but we were able to deal with them as quickly as we can. One key challenge, which we all know, is the bad roads, and it's not something we could deal with as in fixing roads, but then it didn't truncate the work that we were trying to do in any way. We still went ahead and were able to reach all these check compounds and all these communities with talking books, and regularly we visited them to change their content and put in new content. As and when the dynamics of the COVID-19 changes, we're able to also update our content accordingly. One other huge challenge that we faced was in the beginning, where there was so much misinformation from everybody was just giving their side of the story as to how we can prevent ourselves from COVID. So at a point, people didn't want to believe anything coming from outside. So we were challenged a little bit as to how we are going to make people believe the messages that we're about to give them. So the strategy we used was we recorded content from key stakeholders like the paramount chiefs, the Ghana Health Service District directors, religious leaders. Gave some weight behind the messages, some sort of validation, because people in the community could kind of familiarize with certain people that if it means they are adding their voice, then I believe this message.
Gradually getting to the end of this particular response project. However, we are still not too sure whether at the end of December, when the project would have been finished, we will still have COVID around us. So the idea is basically still thinking and exploring ways of trying to be able to mobilize additional funding should COVID remain with us beyond December. We at the moment do not have any specific commitments regarding available funding to support this particular response.
I would not just say beyond COVID. Even within the COVID, we'll still continue with messages on COVID, because there's a likelihood that in some countries they are having second waves. So we're not going to stop using it, with the talking book. But aside that, we would want to focus also on non-communicable diseases. If you look at the data that we have in our district and the few screening exercises that we've carried out in some communities, there is a rising trend in non-communicable diseases like hypertension, diabetes, and it will surprise you to know that even the cancers, cervical cancers, are also rising because we do cervical cancer screening, And so we would want to use the talking books as well to reach out to people little is known about non-communicable diseases.
But we have some specific key areas that if literacy bridge helps to disseminate the information, we think it will help improve the health quality of the people or the health status of the people. We have this adolescent pregnancy that's very high within the Sisala belt. It's very high. I think the last time we had our half year, Sisala West, the Sisala West and other districts, we were having very high data. And I think if you come in that area to support our dissemination information about adolescent health issues, it will help.
There are other areas which I will be happy if the talking book is continuing to be my facility. For instance, issues concerning adolescent health clubs, and then family planning and other messages. I would have liked it to be inside the talking book if it will continue to be my facility.
We have other health challenges that we believe the use of the talking book can help us to address. In Laura, we have low immunization coverage or low patronage of immunization services because immunizations are preventive. They are not services that people need when they are sick. So it's very difficult to promote health when people are not down with illnesses. That is why I think that for the purpose of health promotion, for immunization services, we need that device.
We would have wished that maybe you add something like that will enlighten the people here, because here we are in a smaller place where our clinic, we are not having all the other instruments that can handle certain conditions, so that the people will hear and know that here is not a full hospital, but there's a place that all the things are there for them to use on their problems. I think when they hear it from the radio or the talking book, they will believe it more than we, the nurses, talking to them. Because they believe that whatever information that is coming out from that thing is national or is international. So they trust that one. So I'll be happy they add.
Overall, I would say our project was also impactful, considering what we did and the scale in which we operated in our project. I would like to say it contributed to the success of stopping the spread of COVID in the region. And we also would like to acknowledge that other organizations also did similar in terms of awareness and in terms of service delivery, providing PPE.
So just like any other development intervention where you have partners who contributed in one way or the other to make it successful. Similarly, for this response, we had various stakeholders as well as donors who contributed resources as well as technical knowledge to support the design as well as the implementation of our response. When we were designing the program, we had to engage several stakeholders. We had to engage UNICEF service. We engaged traditional authorities, religious leaders. We also engaged some partners outside Ghana to make some contributions, as well as even UNICEF in Ghana. For example, UNICEF service basically have been with us from the beginning up to this point. We have worked together in the design of this, especially in putting the messages together to ensure that the messages were in line with the government requirements. And of course, in delivering the response were basically was delivered through their community level structures, the community health planning and services, the CHPS facilities. The nurses have been very wonderful and worked very hard to ensure that they use the talking book device to hold their awareness sessions, and that made it possible for the many people who attended awareness outreach sessions in these communities to receive messages on how to protect themselves from contracting COVID-19.